Tonight on City Lights Live, we are celebrating the launch of an important new book. It is titled Maladies of Empire: How Colonialism, Slavery, and War Transformed Medicine. It is by Dr. Jim Downs and published by Harvard University Press. Jim Downs is the Gilder Lehrman-National Endowment for the Humanities Professor of Civil War Era Studies and History at Gettysburg College. He is the author of Sick from Freedom: African-American Sickness and Suffering During the Civil War and Reconstruction, which was published by Oxford University Press. Also, Stand By Me: The Forgotten History of Gay Liberation, put out by Basic Books. He has edited 6 anthologies, including Beyond Freedom: Disrupting the History of Emancipation, co-edited with David Blight and published by the University of Georgia Press. His essays have appeared in the Atlantic, the New Yorker, the Washington Post, the New York Times, amongst many other outlets. He is the editor of Civil War History and a partner at History Studio, where he is also the host of History Studio Podcast. Joining him tonight is Dr. Deirdre Cooper Owens. Now, originally we were going to be joined by Allison Hobbs, but regretfully, she was unable to make it tonight due to circumstances beyond her control. So we're very, very grateful and honored to have Dr. Cooper Owens for gracefully rising to the occasion and acting as an interlocutor for this evening's event. So Dr. Deirdre Cooper Owens is the Linda and Charles Wilson Professor in the History of Medicine and Director of Humanities in Medicine program at the University of Nebraska-Lincoln. She is an Organization of American Historians Distinguished Lecturer, a past American College of Obstetricians and Gynecologists Research Fellow, and has won numerous prestigious awards and honors for her scholarly and advocacy work in reproductive and birthing justice. Dr. Cooper Owens has spoken widely across the US and Europe. She has published articles, essays, book chapters, and think pieces on a number of issues that concern African-American experiences and reproductive justice. Dr. Cooper Owens was recently selected as the 2022 Agnes Dillon Randolph Award winner by the University of Virginia's Eleanor Crowder Joring Center for Nursing Historical Inquiry. Her first book, Medical Bondage, Race, Gender, and the Origins of American Gynecology, won a Darlene Clark Heine Book Award from the Organization of American Historians as the best book written in African-American women's and gender history. It has actually just been translated into Korean. So tonight's event is being co-sponsored by SF Bay Physicians for Social Responsibility. With us is Julie Lindo. I would like to bring her on for a moment to say a few words.
Thank you, Peter. We at San Francisco Bay Physicians for Social Responsibility are absolutely honored to be co-sponsoring this event tonight. And we would like to thank you, Peter Maravellis of City Lights and Dr. Deirdre Cooper Owens for being here, and congratulate Dr. Jim Downs on his new book. I'd like to take a moment to tell you a little bit about San Francisco Bay Physicians for Social Responsibility. We organize physicians and other health professionals to defend health and demand racial, social, and environmental justice. By combining the power of community activism with the knowledge and credibility of health professionals, we promote public policies that support our intertwined areas of concentration: environmental health and the climate crisis, nuclear weapons abolition, and diverting funds away from warfare and toward healthcare, social and racial injustices and the health burdens of vulnerable communities, and education of the public and the next generation of health professionals. Our 2021 events series focuses primarily on deepening our understanding of the connections between these core issues. And if you'd like to find out more, I encourage you to visit our website to sign up for our monthly action alerts, events, and newsletters. And please follow us on social media. And I'd like to mention briefly that we have our annual gala coming up on September 22nd, next week, with the famous whistleblower, Daniel Ellsberg. Also, on September 30th, you are all invited to join our racial equity reading group. We will be discussing Maladies of Empire, So it's a great double feature. We hope you will join us. And on October 13th, we'll have Nicole Perlroth in conversation with Dr. Bob Gold about talking about nuclear cybersecurity. And on November 3rd, we will have an event about war, refugees, and the climate crisis. So thank you for listening, and please visit sfbaypsr.org.
Thank you, Julie Lindo, and thank you, SFBay PSR, for being part of this event, and for, it's great to be in your orbit once again. We've worked with you before and really love what you're doing for the world. It is such a great honor to have both of you with us here tonight. Dr. Jim Downs, Dr. Deirdre Cooper Owens, welcome to City Lights Live.
Thank you so much.
Thank you so much for having us.
So I am going to, and first also, let me thank the audience. It is always my pleasure to be able to share space with Professor Jim Downs. He is brilliant and funny. And even though this is a really dense intellectual book in terms of its subject matter, he writes so beautifully that you sometimes forget it's an academic text as well. And so I'm just curious. Professor Downs, I love genealogy stories. So how did you get interested in this project?
Right. So first, I'm happy to answer that question, but first, just like a quick shout out. Thank you to Dr. Cooper Owens for doing this, and thanks to City Lights. And Julie, thank you so much for being here for the San Francisco Doctors for Social Responsibility. That's awesome. So the project really has its genealogy in my first book. It started when I was working on Sick from Freedom. And when I was writing my book, Sick from Freedom, I uncovered a smallpox epidemic that no one else had sort of known about. And I had sort of pieced together fragments of federal records and government reports and reports from former abolitionists. And I sort of just reconstructed this epidemic. And one of the things that happened is that it, took the lives of over 50,000 formerly enslaved people. And when I looked at the government's response and local government's response, but mostly the federal government's response, they ultimately said a few different things. They said, well, listen, there's an epidemic happening in Charleston, South Carolina, or in Orangeburg, South Carolina, or in Shreveport, Louisiana, and we are here in Washington, D.C. in the middle of the war. We can't actually get supplies or doctors to this region. And so part of it was, all right, well, I understand it's the 19th century and you couldn't necessarily get the resources to these places. So that sort of made sense to me, despite the fact that it was an alarming, poignant story that tens of thousands of formerly enslaved people died at the moment of freedom. From the vantage point of the federal government and even the medical profession, they were wringing their hands saying there was not much that we can do. And then the following year, a cholera epidemic broke out, actually a cholera pandemic. And it began in Asia and it went into Europe. It crossed over the Atlantic, entering into Canada, and then further down into the South. All of a sudden, the federal government was able to develop like an efficacious protocol to stop the threat of cholera. They had doctors deployed all over the South and even the West. Smallpox had been around for centuries. Doctors had known about smallpox, they had seen smallpox, but cholera had been around for centuries, but mostly in the East and in other parts of the world, not in Europe and not in the United States. This was the first time many physicians were seeing cholera or even hearing about it. And so my question was, wait a minute, how did the federal government all of a sudden, after saying it was so depleted and beleaguered and unable to develop an effective protocol, stop cholera, but not smallpox? So I had to finish that book. So I got that book out and I basically said a couple of things. I said, well, it was obviously because of racism but there was also this sort of bureaucracy problems. And I highlight that problem, but then I just move on. But the general history of cholera is typically told as a story, a British story. And it's basically when Jon Snow, not to be confused with Jon Snow of Game of Thrones fame, sort of goes into a poor Victorian neighborhood and basically interviews family members, collects the statistics on the number of people who died. And ultimately what he does is he traces the outbreak to the cholera pandemic to a water pump.
Mhm.
And this sort of canonizes him as being the father of epidemiology. And so I was like, all right, I need to figure out more about what was happening in London at the time and more about cholera, because I had known that story, but that was it. I got to the Wellcome Institute for the History of Medicine in London, and a very wise archivist said, there's material here and we can give you material, but I really suggest you go to the National Archives in Kew and start researching this topic. So I went to the National Archives in Kew, and the first day I got there, I was blown away by the amount of material that I uncovered about infectious disease. And the idea was that Snow had developed his ideas in the 1840s and late 1840s, early 1850s. There were physicians deployed in Jamaica, in other parts of the British Caribbean, throughout India, on slave ships, and all of these different places. And they were thinking about the spread of disease. They were developing ideas about epidemiology. Now, what happens is, which actually is like, I hope my book blows a hole in this sort of mythology about John Snow. John Snow eventually dies, and at the end of the 19th century, his students canonize him as the father of epidemiology. And it sort of puts out this idea that he was the only one. But John Snow was part of something called the London Epidemiological Society that began in 1850. He was one of many doctors, British doctors, who were deployed throughout the British Empire, who were collecting data, who were gathering evidence and trying to understand the spread of infectious disease. And they would come back to the London Epidemiological Society and they would share their findings. So the epidemiology begins as a collective effort as a result of physicians deployed around the world in response to medical crises throughout the British Empire and even earlier during the transatlantic slave trade. So that's a very, very long answer, but I wanted to kind of hit the research parts of it, which are in the book but buried in the notes, and the kind of motivations that inspired this project.
No, I mean, I think that's incredible, because often when, especially as historians, you're kind of, it's easy to trace the great men or the great women of history. And then you do a little bit of digging and you find out that often they're not as exceptional as we think.
Right.
But let me ask you this, because this is really interesting for me. So you were trained as a historian of the US 19th century dealing with war. And now here you are writing a global history about science, epidemiology, medicine, disease, and it's not just the Atlantic Ocean, but the Indian Ocean,
Right.
the Pacific Ocean. I mean, it really is a global history. How did that process work for you, kind of expanding as you were going through the archives? And I also want to shout out someone in the audience, Melissa Barker, the archive lady, who's like, yay for archivist, who gave you that kind of that cue in London.
Right. Well, that's first paragraph of the acknowledgments of my book are the archivist. I mean, I'm always down for doing this. I also want to just say this because if you're just joining us tonight and you're not familiar with Dr. Cooper Owens' work, she is the leading authority on the relationship between slavery and gynecology. So when she asked this question, we always think of the one leading man, but there were many other people. She does the same thing in her award-winning book, Medical Bondage, where we always think of J. Marion Sims, again, as the father of gynecology. And she's like, hold my beer. There's a whole other group of physicians in the South, in the Midwest, I mean, all over, who are doing this gynecological work on enslaved people, on poor Irish women. And that's, so in other words, when I heard that question, I just, as a historian, I want to footnote her contributions and connection to this topic here. So how did I actually do it? So there's a methodological piece to this, and there's a financial piece to this, because historians, have to often fund their own research. So the methodological piece is that I always follow the records. So when that archivist in London said, welcome, go to the British National Museum in Kew, British National Archives in Kew, I went, and when I found the records took me to Jamaica, to other parts of the British Caribbean. They then took me to India. And then I went to the British Library, which has excellent records on the British Empire in India. Then I went back and I started to follow the records in other parts of the world. I went to Malta because Malta in the 19th century was a major maritime hub. You had maritime traffic coming out of the Middle East and stopping in Malta. And so what one of the characters in the book, one of the groups of people in the book are Muslims who were from Europe and parts of North Africa and are traveling to and even Asia, Muslims all the way from Asia, traveling deep into the Middle East for the annual pilgrimage as part of the Hajj. As they're coming back, they're forced to stop, as many boats are, in Malta. While they're in Malta, they're placed in a quarantine facility. While they're in the quarantine facility, doctors, British doctors, French doctors, Russian doctors are watching to see if they're carriers of cholera. And so then again, I'm following the story of these people back to Egypt, other parts of the Ottoman Empire. There's work on Muslims going back to Russia. I mean, there's this whole world of following the sources. Now the question is, how did you do it? As you asked the question about, because I'm trained as a 19th century historian and my first book was on the Civil War. I won the lottery in 2016 is basically the best way of describing this. In 2016, I won something called a Mellon New Directions Fellowship. And I want to give props to the Andrew Mellon Foundation. And this is a specialized fellowship that you can't apply for directly. Your institution has to get nominated for. And so this was when I was an associate professor at Connecticut College. And what happened was you have to apply internally, and then your institution nominates you, and then you go into a national competition. And the goal is, hold on to your bootstraps, because my parents almost had a cardiac when I was like, I want to go back to school. The fellowship allows you to actually go back to school and to get training in another area that you realize your research is bringing you into, but you might not have the tools. And so at that point, I had already started this project, and I wanted to know more from the vantage point of public health, and I wanted to know more from the vantage point of medical anthropology. So I was one of 8 people who won the national competition, and it allowed me to go back to graduate school. Now, here's the kicker. At this point, I have my PhD from Columbia, and I was tenured. I now I got the funding from Mellon. I now needed to apply to graduate school again. So imagine that conversation with my advisor. Fortunately, I was like, I need a letter of recommendation. Fortunately, I got admitted. I got admitted to Harvard, and I went to Harvard for a year where I took courses in medical anthropology and public health, medical humanities, global health. And I was also a visiting fellow at something called the Weatherhead Initiative for Global History. So all of those things provided me with the kind of retraining to do this kind of research. And I give a really long explanation because I think that we talk about the humanities today. We're talking about writing books. We're talking about all of these things that are happening. We have to explain how this is possible. It's possible because there are funding agencies that provide the support, but if you don't have that support, oftentimes you can't do that work. So this project is the result of that major generous grant.
Yeah, it's amazing. I remember I was fortunate enough to get a kind of sneak peek, as Professor Downs was developing this idea into the book that you now have. And I was struck. I remember reading this and just thought, oh my gosh, this is a game-changing book. Like, this is not hyperbole. People who read this book are going to see the intricate and intimate link of slavery to the development of the history of science and medicine in particular. And so I wanted to ask you, because this is the thing that kind of blew me away. Tell us a little bit about the discovery of oxygen and the transatlantic slave trade.
Right.
Because who thinks about oxygen and slavery?
Right. So this is like one of the biggest discoveries of the book, and one that shocked me. And I actually remember where I was when I was finding the records, and I didn't think I was correct. And I went back a couple of times, looked at the record again, and so I'll explain it. So one of the things that we do know that other historians, Kenneth Kippel and many others, Shwande Mustaqim, others have sort of talked about, when we talk about the brutal transport of Africans to the New World, many died during this voyage, and they died from lots of different things. They died from infectious disease, but they also died from the sort of brutal conditions on the ships. And so one of the things that happened was the ship captains tried to crowd as many enslaved Africans into the bottom of the ship as possible. And so they developed all kinds of infectious disease, from smallpox to nutritional problems to scurvy. And one doctor actually, who I write about in the book, Thomas Trotter, advances understandings about scurvy, because he eventually, when he gets to the Caribbean, he notices the people, the way that they're eating the fruit. It's not just eating fruit to sort of restore nutrition to their body, but it's also actually sucking out the juices of the citric fruit that they become, their health is restored. Thomas Trotter eventually becomes an abolitionist, and he goes to testify to Parliament about how bad the conditions are. And what he does is he describes the fact that there's not a, quote, supply of air. And so this is a really important moment within the history of chemistry, because in 1750, chemistry as a field develops as a formal academic study. And you have scientists in France and in Germany and in London. Those are the three places. I won't get into the names now to confuse people. And they're all the early chemists. And they're saying in their laboratories, looking at troughs, which are sort of like these devices, they're like, I think that when the air is captured into this device, it changes its quality. And they're arguing about it. And so basically they're all beginning to develop this idea about oxygen. Now, people know you need air to breathe since Aristotle, but the idea that oxygen, that air changes its quality is a result of the field of chemistry, number one. But number two, they don't know what it's going to do to the human body until Thomas Trotter starts reporting back to them that all of these people are dying as a result of a lack of air, and that the air has actually changed its quality. And so that's 1750. 1890, 1900, the Lancet, the major medical magazine, medical journal, is actually drawing on evidence gathered from the slave trade to say Trotter's argument about oxygen is central to our understanding of this chemical element. So now I'm thinking, okay, that's good, but is it a hiccup? Maybe this is not, maybe even this is the discovery. Maybe I'm not 100% sure that it really proves oxygen. Then comes Stephen Hales. Stephen Hales, everybody would know as a clergyman turned chemist in the 18th century. He develops the ventilator, a mechanically run ventilator that's placed at the bottom of the ships. And if you look at his most recent, his most polished version of a treatise, he says, you know, there are these ships. And in the ships, the ventilators change the quality of the air and it helps people breathe. And so you would say, okay, slavery has nothing to do with this, it's fine. But you got to go back to his second draft. And his second draft, which is now available through online repositories, is called Slave Ships and the Ventilator. So he starts using the slave ship as evidence to prove the efficacy of ventilators. And then when he not only that, in that treatise, guess what he does? He takes evidence from a French captain in the Caribbean. He takes evidence from the British captains of slave ships, and he reports them saying that the enslaved Africans loved the ventilators, that they could breathe better because there were translators on the ships, and they were rejoicing that the ventilators were actually working. So enslaved people are endorsing this scientific innovation and are being used as the evidence to prove it. But by the time you get to the fourth draft, it's like slavery disappears, gets scrubbed clean from the treatise, and he just says, oh, you know what? Ships. Now, Deirdre and I were trained by Black feminists.
Mm-hmm.
And when we talk about Black feminists, or we talk about critical race theory, we talk about all of these different things, we talk about it initially as Toni Morrison would, or Farrah Griffin, or Hazel Carby. What is the presence of the Black figure in Western literature, in Shakespeare or in Faulkner? And how does that image, get erased out of the story of Western literature? Those same critical methodologies and theoretical interventions I used to uncover Black subjectivity in the science records, because it's the same practice of, here is the presence of Black bodies speaking, endorsing, validating, ventriloquizing the value of science, and then all of a sudden getting scrubbed off, erased from the record, and then it just becomes ships. So there's this really interesting, fascinating idea that slavery is not simply just about the exploitation of enslaved bodies. It is not just about the sort of history of the advancement of capitalism, but slavery helped to advance science. And so I think this today a lot, when we talk about the 1619 Project, people say, well, we need to know about the, as an appreciation for the origins of the nation, we have to know 1619. It's not just we need to know about the brutality that slavery inflicted on people. We need to know that slavery is the reason why we now have understandings of oxygen and use of ventilators. This is like actually advancing science as well.
Mm-hmm. Yeah, thank you for that. It's, you provided a really gripping description, but also I think the importance of going to the sources and then going to the originating source, right? So the fact that that there were 4 drafts, written by the scientists is really important. And so the kind of painstaking detail in your research comes through in the writing of this book. That also brings me to another question. What's the relationship between the rise of epidemiology and the decline of contagion theory?
Okay, so can I just give like one more example on the scrubbing clean thing, just because I just think this is fascinating about the records. Now, it's that when Schroeder actually writes his thesis on scurvy, he says, based on a multitude of cases, I know that you have to suck the citric juice directly from the fruit. You can't just eat the fruit. You have to suck the juice out. If you just read that, you'd be like, yeah, multitude of cases, who cares? If you go back to those earlier documents, multitude of cases means enslaved Africans. It's part of the population. He's also looking at sailors and white British people, but he's also learning in those other published writings from enslaved people, but that gets pushed away. So this question about epidemiology and contagion. So any like historical novel or anything from like Dickens or anything, there's plenty of examples that a plague rolls into town and all of a sudden everybody gets sick. So there's a concept of contagion that dates back centuries before the founding of epidemiology in the 1750s, the 1850s. But what happens is that all of a sudden these early epidemiologists who are stationed in Malta and in other places begin to say, I don't think contagion as a theory works. The question is, well, how do they prove that it doesn't work? So again, if you can imagine Malta as a quarantine facility, it looks like a huge castle. And the ships roll in and they park there. And the Muslims are forced to stay, or the other tourists or whomever, they're forced to be in quarantine. And before the pandemic, I would say this, and people would say they wouldn't know what quarantine was, but now everybody knows what quarantine is. So they were stuck in that area. No one could go in or go out. And yet all of a sudden, you had these washerwomen who would walk down these steps. They would enter into the port and they would go into the ships to scrub the clothing and to provide, clean materials for the people. And the doctors started noticing, wait a second, if this ship is obviously, quote, contagious, and the people are contagious, and we're just waiting for the virus to pass, or they don't call it virus, but the disease to pass, why is it the washerwomen are not becoming sick? And so one of the characters in the book are washerwomen, because it's not just in chapter 2, it's also in chapter 3 when I get to Cape Verde. It's the same thing. Washerwomen have close proximity to infected clothing, to infected people, and yet they don't get sick. And when they don't get sick, it completely upends and undermines the idea that contagion is a theory that can explain the spread of infectious disease. Because if contagion was true, then that means as soon as that woman touched the infected linen, or as soon as she got in contact with someone else, she would get sick, but she doesn't. So epidemiology develops as a methodological practice to understand how infectious disease works. But as a way for them to do it, again, what are they doing? Just like in the slave ships, they're drawing from a poor population, a dispossessed population. Again, and then I thought, okay, well, I got washerwomen in Malta that they're looking at, and I got washerwomen in North Africa. Do I have enough evidence? Then I start seeing in India, it's the same thing, except they're looking at hospital attendants. And some of those hospital attendants are people who are washing the clothing. So again, washerwomen, hospital attendants who are within proximity to the infected and often the dead, but don't get infected, undermine contagion theory and call for doctors to start thinking about how disease spreads across a population, which gives way to the rise of epidemiology.
Yeah, I often say that, the way you described it, it's like, this is brilliant. But as you've explained earlier, it really was, so how do I look at these same sources that other folk have looked at, and yet I'm looking at different historical factors, the sources that can provide us with new interpretations of that. Since I'm looking at the time here, we don't have a lot of time, and I do want to get to Q&A, but this is what I'd like to ask you. And I'm looking at a list of questions that I have here. Let's see. You know what? Why does this book matter today? Why? So you have over 40 of us gathered here. Explain to us why this book on the 18th century and the 19th century matters to us today in the 20th.
Okay, so I would say, there are a lot of ways that I probably would have answered this before 2019, is saying that this is important to understand the origins of science, that science is not just an enterprise that grew out of Europe, that these other major social transformations, the subjugation of people, help to advance our understanding of science. And if we think about it in a very simplistic terms, in the way that you think about high school curriculum, which is not necessarily simple, but you have your history class here and your science class here. I'm trying to say on one level, your history class is informing your science, and that matters. So that's a kind of academic answer. Now, in light of the pandemic, I'm saying a couple of different things. One, it shows that epidemiology is a crisis science. So a lot of times the media, the general public, started getting frustrated. I don't understand. First you said masks don't work. Then you said masks do work. First you said lockdown works. Then you said lockdown doesn't work. First you said we should get vaccinated and we want to catch it. Now you're saying you can catch it with the vaccine. What people don't understand is that epidemiologists are not theoreticians. They're not sort of just developing an idea in an isolated ivory tower. They're actually, part of a group of scientists that are responding on the ground in real time. So epidemiology develops in real time. And I think that's an important concept, and that would potentially, get us to, not be so harsh in our criticism to epidemiologists, and to say that they're reacting often to crisis in real time.
Right. That is a wonderful answer. I do want to ask you this. What's the most surprising discovery outside of the relationship to oxygen?
Right. So one of the things that's a very disconcerting piece of research that I uncovered in this book is the fact that and this kind of goes full circle to the incident that I began the conversation with, which is the smallpox epidemic. A smallpox epidemic takes the lives of tens of thousands of formerly enslaved people at the moment of freedom, but it also has disastrous effects for the Union Army and the Confederate Army. And they're both struggling with getting vaccine matter in order to vaccinate their troops. And so they actually turn to this incredibly horrific, disturbing practice of purposely infecting enslaved children and infants with smallpox, so that their bodies, and this was part of a pro-slavery parable, that, slavery, there's the happy slave, the slaves are well fed, they're well taken care of, their bodies are pure. They can infect soldiers or other people because they realize they have other comorbidities, and they're afraid of transferring those morbidities to someone else during this process of inoculation. So what happens is they take these innocent infants and children and purposely infect them with smallpox, wait a couple of weeks for their bodies to develop the virus, to develop the vesicles, and for lymph, which is the fluid, to form within it. They then come along and poke and slice at the bodies of enslaved infants and children to capture the lymph, to then use it as a sort of arm-to-arm inoculation, to then inject it into someone who's a vulnerable, typically a white person. So they would develop a mild version of smallpox, and then they would be protected against it. So again, it's one of these examples as a historian that was shocking, was disturbing. It's hard to write about. And yet I thought still, maybe this is just an isolated incident in the United States and the American Civil War. And doing global history made me slowly realize that this was a global practice. So when a similar crisis emerges in Mexico and there's a need for vaccine matter, Europeans, Spaniards realize they're worried about, like, well, how do I get the vaccine across the Atlantic without ruining it? So they infect orphans before they go on the ships, and then they bring them to Acapulco. And by that point, they have full-blown smallpox. And then they take the lymph from those children, and there's evidence that they bring it to Vietnam and Asia. So this is actually the global trafficking of dispossessed children as carriers of smallpox, as a way to produce vaccine material to prevent the further spread of the virus. So I think, again, that actually raises lots of bioethical questions for us, but it also makes us think even today about how we're trying to get vaccine. I mean, I always think about this in terms of the booster shot. Yeah, everybody wants a booster shot, but think about at what cost to other people in the world and what populations are suffering at this moment. Everybody in the 19th century wanted a vaccine, but at what cost? So these are really important things to, consider.
And thank you for that. I mean, someone wrote in the chat, just heartbreaking to hear it reported by you, but it also makes me think of the kind of two-way mirror, if we can think of Maladies of Empire as the title of your book, right? That the malady is not just the disease, but what you've described, right? That kind of practice as the malady of empire as well. So just
you're so brilliant. I love that you just picked that up. I had a whole paragraph in the introduction that tried to do that. And my editor was a little suspicious of it. And she's like, you can do it, but you need to kind of explain it more. And I was like, I need to get this book done. So we're gonna like leave that to the readers to figure out. But thank you for making that that connection.
So it's a wonderful book. And so I am going to pass the kind of invisible mic on to Peter, but I just wanted to, since you invoked the Black feminist scholars who inspired your work, I always return to a quote by Octavia Butler that I think is really appropriate here. There's nothing new under the sun, but there are new suns. And in Malady of Empires, you've demonstrated that there are new suns if we just
Oh my God.
So thank you, Jim, so much.
Oh my God, it literally, my heart. Thank you. Thank you. Thank you.
So everybody, post your questions because the Q&A is upon us here. Dr. Duleka Raj from Bangkok says, thank you for flagging connections to current pandemic. Thailand does not have enough doses to vaccinate all the population. We just emerged from a severe lockdown. It is hard to read the news about vaccines being thrown out and people already looking at boosters. So yeah, that's more of a comment. Meg Whitman says, how does everyone deal with the guilt?
I mean, this is, I guess, my goal here is not to make people feel guilty as much as it is to inform people about the larger legacies of slavery, colonialism, and war. I think that this is, again, we think about knowing our history as a form of appreciation, and I'm trying to move us, away from that and to say that these major social transformation had a direct influence on the development of medicine and science, and that's something we should just know, and that's just a fact. And I want people to be comfortable in recognizing those facts and not to feel necessarily terrible about it. I do think that as we move forward, I mean, one of the questions that I think the book raises again and again is, where do we get medical knowledge? And I think as the older, the more we move on with the professionalization of physicians and epidemiologists, the more the patient narrative seems to almost dissipate. And yet patients are central informants to understanding medical knowledge and helping doctors think through problems. So I would rather, illuminate that kind of asymmetrical practice of thinking like doctors know all of this stuff and patients don't know anything. I mean, we could think about this, in Dr. Cooper Owens' work on reproductive health and sort of all of the major transitions from midwifery to the professionalization of doctors. I mean, all of that is has pushed away patient knowledge. And I thought about this a lot when the pandemic blew up. Yes, everybody loves Dr. Fauci. Everybody was in love with, I was in New York at the time, with Cuomo. But there was a way in which they continued to propagate this idea that medical knowledge was something that only government officials or doctors knew. And I was living in Chelsea, New York, which is a mixed economic environment. You had rich people, but you also had public housing. And I was going like, I'm sorry, but I'm sure there's a lot of moms in public housing that know where that infection started in their community, what kid got it, what kid didn't get it, what the symptoms were. It's very similar to in Cape Verde. In the book, there was a yellow fever epidemic that broke out, and the British doctors showed up a couple of weeks later. The washerwomen and the enslaved women and the colonized women, they had timed the incubation period. They traced the origin. They noticed the black vomit, which was one of the symptoms. And yet the doctor comes in as like the official person who classifies it and like delivers it to everyone else. And that's a great example of showing that there is a value in patient knowledge and that we should think about it.
Mhm.
Julie asks, I am curious about how the historical narratives you unveiled are still playing out in medical education, research, and patient care. If you have thoughts on that, please do share.
So one of the great examples is that there was a recent review of my book in the Los Angeles Review of Books. And I really loved the review because it was very thorough. But at the end of the review, the reviewer smartly raised this issue about the JAMA, the podcasts, the Journal of American Medical Association, in which doctors in the institution said last spring, well, I don't really think there's racism in medicine. And, this book is based, as the reviewer says, like, this book is showing you there is. And that, so part of it is, we have to sort of think about that the roots of medicine are in fact tangled within racism. And they're tangled within racism in not just the ways that many people expect. Many people define medical racism flatly and narrowly as saying, well, physicians think that Black people are inferior. That's one way of doing it. Or the appearance of Black people is different from the appearance of white people. That's another way of doing it. What my book is doing is saying, how did something like slavery bring populations of people together that allow doctors to study the outbreak of disease? It's very similar to how do prisons bring groups of people together to study the outbreaks of disease. There was a huge thing in Philadelphia in the 20th century on dermatological experimentations done in Holmesburg Prison in Philly, where you had a population of people brought together who were experimented on to sort of advance the field of dermatology. So racism is not just looking at somebody, it's also what are the social conditions that allow for physicians to look at these people. The example I always give, because I'm very interested as a gay man in HIV/AIDS, is that HIV/AIDS destroyed the gay population. It disseminated the population, but it also taught epidemiologists and virologists about retrovirus. Retrovirus was not a topic that many people had studied in the 1980s. And yet, in fact, medical profession at that time coined HIV not as a virus, but as a cancer. Most of the research went into cancer research. They weren't they thought that like they had developed advances in microbiology and virology, and that was no longer necessary. Yet HIV/AIDS teaches people about retrovirus. So my point is that similarly, we're talking about high rates of infection of COVID among brown and Black people. It's not only devastating in terms of the morbidity and mortality among that population, but it's also teaching epidemiologists and virologists about how COVID works. So, it's actually kind of scary, but, when there was the Delta variant that broke out, where did it break out? According to a lot of the quantitative studies, it came out of Provincetown, which was mostly, it was a gay population. A gay population revealed and exposed what the Delta variant looked like. So again, we think about structural oppression, not simply just in terms of looking at someone, but how do the actual conditions of oppression create a laboratory that enable physicians to visualize the spread of disease or to see it in a different way. That's what the book is sort of getting at.
I actually have a question for the both of you.
Yeah.
And this is about having come out the other side of having done this amazing research on your books. For those who are just getting started in this field, who are, haven't gotten their paper yet, but who are struggling through it, could you say something about methodology? Could you talk a little bit about what do students look for? I mean, what could be really useful to somebody kind of struggling in this field?
Ooh, I'll go first since you're the author, so you can have
you go.
The last word, final word. For me, this is going to go against what most historians are taught. We're largely breaking away from the old school way of kind of objectivity as something that is value neutral. So, I often joke when I give talks and I teach my students, I'm like, yes, I write about Black women who were enslaved. I was not born in the 17th century or the 18th century or the 19th century. Yes, I'm Black, I'm the descendant of these people, but my understanding of slavery is also from a book or oral histories that I've heard or read. But when I went to the archives, much like Professor Downs mentioned, kind of looking at the sources, I looked at the same sources that other scholars and historians had used, but I simply pivoted my gaze and my examination on the enslaved women. And so what can a source teach us when we're not looking at the doctors or the slave owners or the people in positions of power? What can we gather from a source? And this is what makes writing about dispossessed populations really hard. They're illiterate. I mean, they don't leave written records for us. So 90% of the information that we get tends to come from the people who own them, or, you know, or leased them, or, you know, that served as wardens in prisons, blah, 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 blah. So for me, it was, how do I gather information about these historical figures from the sources and interpret this information differently? How can I, through my own knowledge, based on my training, but also my own experiences as a Black person, even though white supremacy evolves over time, the thing that has been unending since this has been a colonial nation is anti-Blackness, unfortunately. And so with my own understanding as a Black woman, I knew, and as a Southern Black woman, I knew, let's see if someone was pregnant, you know, when it came to looking at the James Marion Sims census report. Everybody else was interested in, oh, let's see how many slaves he leased or owned so we can know how rich he was, because they saw slavery as an economic labor institution. I understood slavery very differently. Yes, it's an economic labor institution, but let's look at these women. Did any of them give birth to a child? And guess what? One of them did, and the child was listed as mulatto. The only mulatto child or person in the entire slave farm. I didn't change the methodology, right, that I had been taught. I simply pivoted my gaze to the historical actors to see them as kind of flesh and blood, fully formed human beings who had their own experiences. So I may never have known their names, their likes, their dislikes, but that census record told me that something happened during the medical experimentation phase for the father of American gynecology that was unethical, even in the 19th century, and illegal. And so that's what I could gather. I may not have all the answers, but I could certainly raise critical questions. And so that's what I would tell students: trust your own experiences that will lead you to ask different questions.
Yeah, I mean, that was powerful and eloquent. And I would say basically the same exact thing. Trust your instincts when you're reading the sources. Sometimes what other scholars have said can blind you from seeing what's actually there. And then the other thing is, and Dr. Cooper Owens has said it in one way, I'm going to say it in another way, and that is my training, my undergraduate training was in literature. So I would always say, here's the plot of the document. This is the intended way the document's supposed to be read, but I'm going to flip the script on the document and read it in a different way. That's why, you know, it's like Toni Morrison's Playing in the Dark. That's what it was called. It was called Whiteness in the Literary Imagination. She's basically, in the novels, she writes all the novels, but she writes this piece of literary criticism, which is, what is the presence of Black people in this fiction? And so the novel, like, it could be Absalom, it could be any of these stories with white protagonists. And she's doing exactly what Deirdre is saying, which is, you know, pivot and look at the Black character. Now tell the story, the same story, but from the vantage point of the Black character. So when I learned to do that as an undergraduate in literature, I then applied that method to the medical journals and said, all right, some of these women, I don't have a name, I don't have a last name, I don't have a census date, I don't have anything else that would matter for like political historians and social historians. It would render her completely invisible because I just have Negro woman. Mm-hmm. But if I took that phrase Negro woman and said, well, why does that matter? Or why does this washerwoman matter from Malta? And I make the whole story, as I do in chapter 2, about her, then it retells the history by assigning the value of the plot to her as the protagonist as opposed to background. And that's one of the things that I've been doing, and I've been thinking a lot about. And as we're doing this, and I have to ask Dee now, I'm going to Deirdre now, maybe this could be a panel at AHM, because I've been thinking about this too, and that deadline's coming up, so we need a chat. But this is this question, Peter, has made me sort of see how Dr. Cooper Owens is thinking about this similarly.
Yeah.
Well, this has been a very rich and a very eye-opening discussion. And I'm really grateful to you both, Dr. Jim Downs, Dr. Deirdre Cooper Owens, especially coming in at such a last minute. And it was just wonderful. Thank you both so very much. A very big thanks to our co-sponsor, SFA Physicians for Social Responsibility. Also, a big shout out to Amanda Ice over at Harvard University Press for all her efforts. And thanks to all of you in the audience for helping complete the circle.
Thank you. Just thank you so much. Thank you, Dr. Cooper Owens. Thank you to Peter. Thanks to Amanda Ice at Harvard. Thanks everyone for coming. Such a thrill to be able to do this. Zoom is actually like Zoom book talks are like the only good thing that came out of the pandemic for me. So I am so happy to be able to share my research with you, and thank you for coming.